A warm welcome to all of you. Thank you for joining us in this second series of Chiropractic and Physiotherapy, Health and Wellness. Today we shall be focusing on women health, and that is pregnancy, prenatal, postpartum, and menopause. So we are live on TikTok, YouTube, and Facebook. So joining me on set are two medical experts. On my right is Dr. Catherine Njogu. Dr. Catherine Njogu has a doctorate in chiropractic medicine, and she's been practicing for over 17 years, 16 of those in the United States. Welcome, Dr. Catherine.
Thank you for having me.
On my left is Dion Njogu. Coincidentally, they have the same surname. So Dion Njogu is a physical therapist. She's been a physical therapist since 1982. She'll be 43 years. And she's worked in several hospitals, and she's the CEO and founder of Chiropractic and Physiotherapy Health Center. Welcome, Dion Njogu.
Thank you very much for having me.
Is there retirement in physiotherapy?
What we say in life, there is no retirement. You just slow down to whatever you are doing, so you retire from the tiring. But in nature, there is nothing to do with retirement. You have to continue until your maker tells you now to rest.
Oh, okay. So you just stop the tiring.
Yes.
All right. So we want to talk about pregnancy. So pregnancy is a remarkable journey, but it seems to come with a lot of back pain, hip pain, tailbone issues. It's a myriad of musculoskeletal issues. So what goes on during pregnancy, Dion, that brings about all these issues?
Okay, it is true. Pregnancy is a natural phenomenon. But nobody or anybody is aware what the effect of pregnancy will be on you. It will be in a big area. You find that some women don't have even a slight problem during pregnancy. They enjoy their pregnancy until delivery. You will have others due to hormonal issues. They start even having problem. Instantly they get pregnant. Others will just go even for 5 months without any problem. Then they start problems. So you can't tell what is the problem because our bodies are created differently. Now you know these things which will happen to you when you get pregnant. You might go naturally up to delivery, get problems during the pregnancy, or in the middle, starting of pregnancy to mid, it is so bad. Then after that, the baby decides to make the mother comfortable. So you can't tell until you get pregnant. You experience it is when you know what your body reacts to the pregnancy.
Okay. That's interesting. So, Dr. Njogu, what is chiropractic medicine, and does it have a role during this period of pregnancy?
Oh yes, absolutely. So chiropractic medicine is the healthcare profession that addresses the spinal column, the discs, the related spinal nerves, and taking off the pressure of those nerves, which honestly, wherever they go everywhere. They go to your skin, they go to your muscles, tissues, organs, bones, right? Mm-hmm. So when you're thinking about pregnancy, as the woman's body changes for the baby, right? It's very natural to obviously have, in the first trimester, morning sickness and nausea, yeah, and that's more hormonal and endocrine in nature. But it has also a lot of, as she's developing, her breast tissue grows, like her belly protrudes forward. All those things cause that musculoskeletal misalignment and asymmetry, because the body's changing for the baby. Right? So in my years of experience of seeing this, we've had women who've had either sciatica, carpal tunnel syndrome, headaches, right? Upper back pain going to the neck, the lower back, obviously, because when the baby starts growing, the belly protrudes forward. And that also causes what they call hyperlordosis, meaning that the lower back is actually exaggerated. And that puts pressure on the nerves, right? As the baby is growing, and as the mother's body is changing for the baby, those spinal nerves get interrupted and stress is put on them because of those asymmetries and that pressure from the baby growing. Okay. And chiropractic.
I'm surprised, just before you continue, carpal tunnel syndrome and pregnancy. Okay, there's a connection.
Well, think about the brachial plexus. So C5 through T1, when you have the breast tissue developing, and obviously, as the baby grows, more in the abdomen, not in the lower back, but also the upper back, where the breast tissue causes a lot of what they call cervical thoracic junction type neck and upper back areas. And depending on what nerves are compressed, they can go straight into your hands.
The hands. Okay.
Yeah.
All right.
Because most people don't really realize that carpal tunnel is not just only in the wrist, it starts in the brachial plexus and anywhere in that trajectory of the nerve. So as chiropractors, we always go to the trunk of the tree.
The spine.
The spine. Look to the spine to see what's happening there as the woman is changing for the baby. And we always find, this changing because of what's happening here. Also in the lower back, sciatica, with the abdomen protruding forward. What happens is then obviously the baby grows, but then also too you have what they call a pelvic imbalance. And also the lower back bones, also because they're hyperextended, right? They put pressure on the nerves that actually leave the lumbosacral plexus, which goes into not only the womb, but also to the pelvis. So those things are what we see during the pregnancy stage. And I have had clients come in, they're like, I have a headache, I have problems with my shoulders and neck and my lower back, and I'm not sure that I can actually even be able to walk. And I'm like, no, let's treat you.
Okay.
And so our profession really helps with that. And I mean, I can count the number of women on 4 hands who have come for chiropractic care during their pregnancy. And that really helped them, especially with the pelvis. Yeah.
All right. So it helps with the pain. Okay.
It also helps too because the nervous system controls every organ system. There's also an input also to the baby as well, because obviously when you actually address the pelvic imbalance, the pelvic imbalance is so important, especially in the 3rd trimester, because you have what they call breech position. And the baby is not facing down.
The head is not facing down.
It's actually up, and the feet are actually, protruding down instead.
Okay.
That pelvic imbalance is so important to maintain that, so the baby has room to move into the proper position, so that way the baby can grow, number 1, properly. Number 2, the baby can actually be in the proper position to actually present what they call cephalad or vertex, so that when you actually deliver, there are no labor issues, and delivery is actually spontaneous.
Get a normal, spontaneous.
And I'm sure there are many women who want to have that.
Yes. And on that issue, having a normal, spontaneous delivery, exercise is very critical. And Dion, this is where antenatal exercises and physiotherapy comes in. What is the role of these exercises, and should they be begun right at conception, or at what point should a mother begin this?
That's a very good question, because most of people think when you get pregnant, that is okay, now you can wait for the baby to grow and then up to term. We don't care for our mothers, they're in the medical profession. We just tell them to come for antenatal to be checked. We don't check the mother usually. To say this, most of us check on how the baby is doing. The advice I tell our young mothers is that I'm sure majority, if you have no complication, you go to see your obstetrician at 50th month. When you are going to see your doctor for the 50th month, you should start what we call antenatal exercises. The importance of the antenatal exercises is that the baby has its own environment to grow in, but it will interfere with your natural body shapes. The issue is that when the baby is growing, they shouldn't stretch your muscles of the stomach such that it can make them even separate. which is very sad. But if you start exercises, you'll find your muscles of the stomach get so strong, the baby has to look for its own way to grow without stretching your abdominal muscles. It is true it will grow upwards and make you look a bit plumpy. But the exercises being so strong will make you feel like you are normal the way you have been all the time, unless there is a complication. The other thing you'll find that when we are expecting, the baby puts so much pressure on our bladder. You find a pregnant mother will go to the loo as many times as possible. This makes them become loose on what Dr. Jog said, the pelvis. The muscles of the pelvis are like a swing. The more you loosen the swing, the more it goes down. So the aim of the exercises before delivery is to maintain your tone of muscles on the birth canal and even the bladder. So you should be prepared to maintain your strength as the baby grows. Nothing will stop the baby from growing. And then I ask the mother, don't let the baby spoil your features of the body. So in that case, I tell people, the day you are going to see your obstetrician, make sure that day you take at least 40 minutes to see somebody like a physical therapist to show you the exercises you are going to do during that period. Whenever you go to see you go for a clinic checkup, that day make sure you get exercises from your physical therapist. And the other thing I tell mothers, let people know you are pregnant from the front. We don't want to see you pregnant from behind. Because the more you relax, the curvature of the back goes, you find the baby is there and the mother is here. That is not a right thing to do. We should strengthen you such that you continue with your job you have been doing. The only thing, you just do it slower than what you have been. And that way you'll find the baby grows nicely in the pelvis without affecting your posture. That is the importance of exercises during pregnancy.
Okay, all right. Dr. Njogu, we had a lot of questions where women are asking, are there tips you can give them before they conceive so as to make this journey easier? Are there things that women can do to make the journey during pregnancy easier right before they conceive?
Yes, I think as John was saying, in terms of even just maintaining the vitality of the pelvic floor, right? Really, I think exercise, like yoga and stretching are going to be very important even to do before and to continue doing those during the pregnancy with obviously modifications as the baby is growing, of course. But that helps them to be, number one, healthy and also to be active. Okay. Yeah? Because if you're going to start those when you are pregnant,
it's too little too late.
So I tell people, have a contingency plan. Make sure that you're doing those things before. If you know obviously you're going to get married, yes, people plan for their marriages, but they don't plan for the pregnancy.
Yes.
So plan for the marriage and the pregnancy.
It's true.
You get the marriage and the cradle, of course. Yes. That's that number one. Number two, I've also seen the importance of chiropractic treatment. Even to that should be what they call a no-brainer, because if your nervous system, which is the master controller system of all body systems, is working well for you, honestly, even during pregnancy with a good physiotherapy program, you're not going to have any issues.
Should be smooth.
So really, I tell patients, you know what, even if it's just getting a monthly or bi-monthly check on how your nervous system is working, I mean, honestly, that's, to me, it's like it should be up there with going to see a dentist every 6 months, going to see your GP. Sometimes you need to help control like just your maintenance, as well as when going to see an eye doctor once a year. The nervous system, if it because it is the master controller of all body systems, it should be in proper functioning mode, at its potential, because that's where your health does come from. And as you are planning, your children, right, and you're getting that constant care, yes, we can also focus and have a plan for you during your pregnancy with physiotherapy treatment to help you at least, number one, not only get achieve those fitness goals, but even have a normal spontaneous delivery.
Mhm.
And also, even for the health of the baby, even for the health of the baby and the mother, those things are going to be important.
All right.
Yeah.
Dion, we get a lot of women coming into the health center postpartum with so many back pain issues and a lot of other musculoskeletal issues. What is the impact of delivery on the body, both normal delivery and CS, and what role does physiotherapy play right after delivery?
Okay, as I said, you should start this journey immediately you realize you are going to give birth. During antenatal, if you get a good physical therapist, we will tell you what to expect after delivery. Unfortunately, majority of our mothers don't get this. The best thing when you go to the hospital, I'm sure the doctors just want to deliver the mother and they finish with you. But what we practice, especially for now when I used to work in the hospitals, is that when a mother delivers naturally, they should be made to lie somewhere flat. They bend their knees and imagine they want their back to press the floor.
The lower back.
Yes, on a flat area, even if it means the delivery room on the floor. Because during the labor, the arching of the mother and the diving of the baby, they misalign your lumbar spine, putting pressure on your bone, which we call sacrum. So the sacrum has to give way for the baby to dive in the birth canal. That process is a very natural one, but it leaves a dent on the mother. So I tell the mother, immediately you deliver, let the person delivering you put you to be on a flat area, even if it is a floor. You do, we call them pelvic tilt. It helps the bones of the pelvis and the ligaments of the lumbar region to go back. We call it snipping back. And after that, when you get out of that position, you don't feel the back as if you have delivered. That is the first thing. Then when you go back now to the ward, you have already delivered with your baby, make sure you rest. When you are resting, make sure you are in a good position. That is, you can be even flat and lift only the head up. When you are not asleep, make sure you do pumping of the ankle joints. Tighten the muscles of the calf. Exercise, imagine you are squeezing your thighs together because those muscles were in tension during labor. When you do it like 3 to 4 times a day, you'll find that when you start walking to go to the bathroom or to shower, you don't feel anything. Because if you don't do those exercises, because of the pressure which was within your pelvis, you'll find as if your legs are swelling. It's nothing wrong, it's because the muscles were not doing anything. Start making them work. Then after that, whatever you are taught before delivery, you start those exercises of the pelvic floor, tucking even your tummy, breastfeeding postures, so that you don't arch your back, so you get proper ergonomic positions for you after delivery. And I think apart from the natural pathology and the physiology, your body should be feeling as good as when you are not when you had not delivered. And then you continue with these exercises. Always make sure the baby is the one to come to your breast. It's not you to go to the baby. So put things to make sure when you're upright, your back is straight, and breastfeed your baby when you are upright. Okay. Yeah? And always be taking a good rest. That is a natural birth. If it happens that you have to go through cesarean section, immediately you leave the theater and you are awake, the first thing is to do what we call deep breathing exercises. This is because the baby was pushing your breathing muscle, which is really in the chest. For you to get deep breathing, you have to practice it. You take a deep breath through the nose and out through the mouth. If you do them 4 times, every hour 4 times, you'll find that even the pressure which was around your tummy starts going away. Okay. Then after that, nowadays people don't even get complete rest, and you sit up. And when you sit up, you get the proper posture. The same way, like the other mother, you start exercising your feet, your toes, your ankles, your thighs, and the back. And imagine you do, when even seated, you imagine you are doing a pelvic tilt. That helps the pelvic muscles which have been injured during delivery, because even the cesarean section, they also get injury. Not that there isn't, they also get due to the activities they do. And a cesarean section person, within 24 hours, they should be walking in the ward. Because the second day, you should be mobile everywhere. You should be able to hold your baby. You should be able to bathe yourself, because there's nothing else the doctor did, unless there's a complication. The 4th day, you should be back like the person who delivered normal. It is not something to say, I was done, the cesarean section, I'm different from the other mother. No, it's the process of delivery which changed. So you shouldn't say a cesarean is unless there is a history of what we call in medical pathology problem, which will be dealt by your doctor. But if you deliver normally, then you start exercises immediately. The only thing, they are not like exercises after 6 weeks, because after 6 weeks, we will give you now a program of somebody like normal to start your exercises to go back to yourself.
Postnatal exercises.
Postnatal exercises.
Okay, all right. Dr. Njogu, we had a question where someone said 3 months after giving birth through CS, they were having a lot of problems bending. It's a very painful affair. What could have gone wrong, and what should they do?
I'm actually asking myself, because even after what Dion had just talked about in terms of even the difference between CS and vaginal, in terms of even having that program with postnatal, how you deliver, that should be the issue. My question, I guess, for the woman is, did she have any issues before she was carrying her baby? Like, was she having any lower back pain as she was carrying the baby to full term? Had the CS, didn't necessarily have a good program postnatal, because that also can make all the difference.
Yeah.
You know, it's really about, okay, was that problem there to begin with? Or even if it wasn't there, was it actually building up? So then now she has the baby through CS, and of course they nick different muscles. Of course, the bikini cut, you have the baby out, and the healing time, but also through the exercise program. Are those things there in place? I guess that's my question for her.
Okay.
Because really, maybe she didn't have those, maybe she didn't know, and that's a real thing.
Yeah.
But what we can, I think, what I really suspect is she didn't have the proper posture, even like in terms of the muscles and the lower back and the pelvis were not in proper alignment during her pregnancy. Now she's had the CS, and I'm sure she had an epidural, right?
Oh, yeah.
And 50% of the time when you administer an epidural into your lumbar spine, 50% of the time I've seen this, will have a lot of lower back issues, right? Because of where the injection goes into. But also there may be an underlying problem there with that. So the epidural itself, and also to the underlying issue, may cause what she's having now. And also to just overarching back, obviously even after CS, and not having a good program, that can also be an issue as well.
Okay.
Yeah. So
to add to what Dr. Njogu is saying, when people get CS, they remain in a stiff position.
Yes.
And if your pelvis is not getting movement, the spinal column sits on our pelvis. So if there's no movement on your pelvis, which I'm calling pelvic tilt, the muscles of the back stay stationary. So the day you attempt to bed, they won't agree.
Be screaming.
You'll be screaming. But when you start with the pelvic tilt, with your knees bent, you are mobilizing both the front muscles of your tummy and both of the back. Rolling your knees left and right, they help the bed of the spinal column to be mobile. So when you wake up, you will not be having issues to bend over because they have already been mobilized. So pelvic tilt post and after delivery is the most important thing in a woman.
Okay.
Yes.
Interesting.
Also, to add to that, it's interesting you said that too, because that's the case. And even with the pelvic tilt, it does help. What if she has an SI joint issue?
Yeah.
Which happens all the time in pregnancies. And there's even the technique as chiropractors we are
SI
taught.
joint being sacroiliac
joint,
okay.
yeah.
All right.
And that's always constantly there in a lot of women who have lower back issues or pelvic imbalances. There's always going to be a sacroiliac joint issue. As chiropractors, we are taught a particular technique to help more or less resolve that pelvic imbalance, which then obviously causes even problems with carrying the baby to full term.
Oh, yes.
So definitely adding to in what Dion was saying, that pelvic tilt, and we tell a lot of our clients who have that hyperlordosis, whether you're pregnant or not, male or female, it does help, obviously, universally, but especially when you've just had your baby.
Okay.
Yeah.
All right. So there was a question on diastasis recti. A bit of a complex medical term. Yes. What is that, Dion? And how does it occur? And how can it be corrected?
Most of the time, when the baby is growing, as I said, if your abdominal muscles are weak, the baby also, with its fluids and everything, starts pushing. So what will happen? When you are pregnant, you can look at yourself in the mirror. There's a black line which is between your tummy through the navel back to the pubic bone. That line is to tell you that there is a separation of muscles on your right and the left. If the stretch is too much, the babies open up just slightly above the navel, and it opens up in such a way that the black line disappears. So in actual fact is that the muscles of your right side and left are no longer together. That's what happens. That is the overstretching of the abdominal muscles during pregnancy, such that they can't come back together. So when you have the lectures, the only way is to get back to physiotherapy, depending on the severity. If it is not very severe, the physiotherapy postnatal exercises will help you to bring the muscles back and strengthen the abdominals. But if it is too severe, here we have to involve the doctors to go and do it surgically, if it is too severe. But if it is mild, we do exercises for you, abdominal exercises, to strengthen the muscles, and then they can come back together again. I don't know what Dr. Dogu can say about it, but that is what it is.
Yeah, in a nutshell, what Dion talked about is the case. Yeah.
Okay. Absolutely. So usually after delivery, mothers, there's a bit of self-esteem issue, and you want your body to go back to normal, and you get your figure back, and there's a dash to get corsets to get that stomach back into shape. And is it advisable to get corsets? And
well, for our old parents, our great grandmothers and mothers, they thought it was the best way to do it. But if you have been exercising before delivery, and then after delivery, you start the exercises program, you don't need a corset. Because what makes people feel, when you hold these muscles, which have been stretched almost a foot, you tie them up, they are going to be very weak. So you'll have the stomach very inside, but when you hold it, it can be pulled. So the best thing is to strengthen the abdominals, and you'll find it going down back slowly. The thing why people feel like the tummy is not going back is also the diet. If we take a lot of starch postnatally, automatically we will accumulate so much fat on the tummy, and it goes where the pores were being stretched. So the best thing is to go in a proper diet. The other thing, you tighten your muscles of the abdomen, because the muscles of the abdomen are the corset of your lower back. The ligaments which hold the baby are all from the back. So if you don't tighten naturally your abdominal muscles, you'll always have a backache, and you'll feel always your tummy is bigger. So the only thing in life is exercises, because our mothers, they don't do the exercises we do, but the type of work they do postnatally forces them to use their abdominal muscles to be able to work. But us, because of office work, nothing much, we relax, so the muscles don't do anything. So you have to exercise abdominal muscles. It's just a cylinder of muscles, and they are all attached to where? To your back. To avoid any low back pain, strengthen your abdominal muscles and the upper back.
Okay.
Yes.
So strengthen the abdominal muscles and upper back.
Yes.
And I would like us to move to the issue of menopause. Dr. Njogu, what happens during menopause, and does it have an impact on the musculoskeletal system?
Yes, so menopause is when the level of estrogens that you produce now starts to dwindle and actually starts decreasing over time. And so that also happens when you start getting irregular periods this is when you are regular, then your cycle starts slowing down or winding down. Okay? As a result, as we in the aging process as well, you stop making a lot of collagen molecules, which are responsible for the elasticity of your skin. So you see a lot of wrinkles, a lot of even with tendons and ligaments, you can get some weakness there as well. At the same time, also too, with estrogen being depleted, estrogen is one of those sex hormones that in women is so necessary for calcium to bind to bone.
Calcium to bind to the bone.
To bone, yeah. Okay. So it helps with that mineralization of the bones themselves. So as we're going through menopause, and being postmenopausal, when you don't have that enough amount of estrogen available, for that we see a lot of women who have what they call osteoporosis, osteopenia, and also to the weakening of those ligaments and tendons. So things like frozen shoulder, you see that, the term is called adhesive capsulitis, but frozen shoulder. A lot of wear and tear, especially in the knees, in the joints. And for a chiropractor, we recognize, okay, this is what the person is in their life. And now how do we now treat them? By using specific techniques. Obviously, are not necessarily going to be what they call high velocity thrusts, but to number one, obviously, is just say yes. When was your last period? When did you get menopause? Do you have like a DEXA scan to show your level of osteoporosis? To verify that, of course, plus also vitamin D serum readings to then determine, okay, do you have enough vitamin D, yes or no? And then obviously you supplement the vitamin D3 with calcium to help bind the calcium to bone. So that way, at least even, number one, you can even actually see some reversals in osteoporosis after a while of vitamin D3 supplementation and calcium.
The sun is not enough.
Well, I wish it was, but we don't sit in the sun long enough to actually get anything because everyone is indoors nowadays. Yeah, and that's the downside of the workforce that we have, and everyone wants to not be within the sun because but controversies around the sun and getting skin cancer. But at the end of the day, I think even with our mothers, they used to actually sit outside in the sun, and you never really saw a lot of them getting osteoporosis. But and that's another topic for another day. But when we see those things, we know very well, like with chiropractic care, it also helps not only with the joints, the health of the joints, but also too, because the nervous system is the master communicating system of all organ systems. It can also get into a lot of into the areas that obviously stimulate even what they call like joint mobility. Menopause is also very emotional too for a lot of women. So it also helps with that emotional component as well. But for me, what I find with menopause is actually just that joint health, and also to, with supplementation, how we can actually help women still be able to exercise, because when exercise is very important during menopause, but also to the diet as well. So as Diana was mentioning earlier on, if carbohydrates and starches, probably not a good idea.
Proteins.
Or proteins, what Dr. Jog is saying is, if you look at the whole system of a woman from the time they reach puberty age, you go through phases, which is a very special way God created women. The only thing we are not doing is to make women understand these phases we are going through. Because being told about menopause, you are not the first one.
Everyone will know.
It's a very good process to go through when you are aware.
Yes.
But it hurts when you are not aware. Because if you start sweating and feeling hot, you just move from people, get good air. Because you know why. The way when from puberty you start having periods, you are aware periods are going to come. Then when you start getting babies, delivery, you have to take care of yourself. So even menopause, the women should be aware it's nothing. It's a natural phenomenon. The only thing is to know, how can I relieve this? Go to your doctor and tell them, I think this menopause is crazy. How can you help me to reduce it? And use as many methods of making yourself active to reduce these feelings of menopause. Because let me tell you, you have talked about menopause. There is another stage called after menopause. It's another crazy area. But if our doctors and our community help us to understand our bodies during those stages, it will not be an issue. We shall live a good, very life and be proud to be a woman. Because when the womanhood finishes, the way God created us, those menopause, premenopause, or whatever it is, we will go back to the natural hormone, which is the man's hormone. And that's what we had when we were not yet women.
Oh, before puberty.
Yes. So these phases of women is just a natural way of women the way God created this. And we should go to it with pride. Not when you are menopause, you think you are finished. No, you should be proud of it. Yeah. Just understand it and then ask your doctor to help you to go through it. Okay. But don't take it as a big issue. You have gone through it and we don't feel it. You just go ahead with your life. It's menopause, it has come. Handle it.
And it's interesting you say that, because I think it's a stigma.
Yes.
Some reason, yeah. And why should we make it? Why should actually stigmatize it? Because that's going to be inevitable. Number one.
Yes.
But it's also a good thing from a proactive standpoint. So this is going to happen. Yeah. It's a good thing. Let's see how we can actually work with, easing into it, dealing with it, and then easing out. And really look at it as an opportunity, as an adventure. Yeah. And I think that's where the alternative healthcare system, medical professionals, like physiotherapy and chiropractic, we understand that.
Yeah.
We know that that's the actual rhythm of the body of a woman to actually go through those things, and to help women to understand this is okay. This is normal. Your mom had it, your grandmother had it. There's nothing wrong with that. It may occur earlier in your life or not, but that's okay. Let's now see how we can actually make the best of it.
Yes.
Okay. There's a video I saw on TikTok, and the person was saying women as they age tend to lose 2% of their muscle mass every year. Is that true or is it false?
But not only women, to be specific, it is also even men. There is an age, I can't remember whether it is after 65, people start not doing what they are supposed to do. You find that most of people want to use the upper back more, from the waist upwards, but the lower limbs, they don't want even to do much. They don't want to walk the way they have been walking. When they go to the gym, they only want to do things which are not involving the lower part of the body. The reason is it's an aging process. I think if I can ask you, the doctors, they will tell us what hormone disappears for us not to be able to feel or to do anything. You want only to sit on a chair and call your grandchildren to come and help. So when you get old, you don't want to do anything else. Just eat, take a slight walk, and come back. So it's an aging process.
Okay.
Yeah. And you will find that in our communities, you will find most of people will take a stick and force themselves to go out walking. So in this case, we lose this muscle because it's a process of aging, but we need to do something about it, about these muscles, to be able to maintain them. They can't go back to what they were, but you can be active and do things you can. Not like when you are a young man of 30 or a woman of 30, but now being in the 70s, you need to do something to maintain whatever you have. Otherwise, losing the muscle is a natural phenomenon in aging and getting old. That's what we call, in fact, if you look at it, it is called sarcopenia. It is there in the medical.
Sarcopenia.
Sarcopenia.
Okay.
Loss of muscles due to aging process.
All right.
And that's why they are called the seniors. They have left the juniors, now they are seniors. And seniors have to have their own program to be able to maintain their muscles, loss, reduce it instead of accelerating it.
All right.
Yes.
I can see we are running out of time and we need to wind up. So I will ask Dr. Njogu, any advice, any parting shots?
Absolutely, yes. Chiropractic healthcare has been so vital in the patients that I've seen during their pregnancies, during their first, second, and third trimesters, but especially the third trimester, preparing them for what they call the normal spontaneous deliveries. I think it's an alternative to actually seek out chiropractic care to help address all your concerns and needs during your pregnancy. And it works.
Oh, great.
That is good.
And Dion, any last words?
Yeah, majority of our community just hear about physiotherapy or what you call physical therapy. Everybody has an area where they have experienced about physiotherapy. But I will tell everybody, physiotherapy is physical medicine from giving birth to ICU. So physiotherapy is so wide such that if we sit to talk for every condition about physiotherapy, we will finish our whole year discussing it. So what I want to tell our women or mothers is that you are made special by God. And if you know that you are special, for every stage you go to, there is always a process which you can accept it with all your heart, and you will pass through it with joy. And you will talk about it when you reach 85 years, giving the story of joy of being a woman.
Right. Okay.
Thank you.
All right. So let's be proud to be women. And in light of this, Chiropractic and Physiotherapy Health Center has an offer running for 6 months. The first 2 sessions of antenatal care and first 2 sessions of postnatal care will be for free if you reference this webinar. So right now we want to go over and hear from one of our patients who's been a beneficiary of our services.
My name is Pauline Wanene. I've been coming to the Chiropractic and Physiotherapy Center for a year now. And what led me to starting to come for sessions early in 2024 was I had begun my fitness journey, if I may call it, late 2022. So at this point, I had been exercising not too consistently for about a year. We had our annual fitness tests at work. One of the things that was called out was my flexibility, and just a bit of mobility issues, especially in my upper body. And that was the previous year, 2023, in around October. So beginning 2024, I think it must have been part of my New Year's resolutions, just to try and see what it is I could do differently for my health. So I consulted around. I actually happened to be talking to a colleague of mine, and he mentioned that he comes to the physiotherapy center at the Westlands branch. So he sent me the contacts, and I was able to set up an appointment in the first session. I think what gave me some confidence is the fact that there's a test you do when you come in on the first day, and whatever it is that the physiotherapist told me on that day correlated with exactly what I had been told. So I also felt like there was a bit of, okay, they've gotten the problem that I'm here to fix. So I started my sessions at that point in time, and what I noticed is, so initially it was a bit intensive. Then I went just reducing the frequency. And what I need to point out is, when I say I started my fitness journey in 2022, I have been sedentary all my life. I've not been an athlete. I've not consistently exercised. I don't move. My body was what I would always describe as tight or a bit heavy. Sometime in 2019, I had a persistent knee pain on my right leg, and basically all these things just made me realize that my body was not operating the way it's supposed to be operating. And so when I took the recommendation to do this session seriously, I knew that it was going to be important. And I think out of the 1 year that I exercised in 2023, I noticed, the pains and my fear. Actually, my biggest fear has always been to get injured, because I know as you get older, injuries then become a bit more serious in terms of your recovery time. And then I'm already on this journey of getting fit. So do I really want to get hurt? And now I can't exercise anymore. So what I noticed is, as I did the sessions, the movements in the gym became easier. And I was able to increase they call it range of motion. I was able to increase my range of motion for most of the movements. And therefore it was sort of like, it was feeding into another area of my life that I was really keen on doing very well. So as I progressed in the kind of movements I would do in the gym, I realized, oh wait, this is actually a very good support system for my gym life, because my recovery was faster, the movements I could do are more, and it sort of fueled me to keep working, and to especially keep my appointments. So it's been a very, very important journey for me, because I've also come to understand how my body works, so that when I'm having my session done, I engage the therapist in terms of what it is I'm feeling in my body. And the most interesting thing I think happened this year, if I'm not wrong. I went in for a session at the Ridgeways branch, and as she was working on my neck, she asked me if I was getting headaches. And it was, I think, on a Friday, and that whole week from Monday, I was having migraines every evening. And again, it was interesting to see that the things I was feeling, she could actually tell during the session, and after the therapy that day, the migraines disappeared. It's something that I have recommended to my son. So my son is a power lifter, and he's also started coming in for some sessions, and just trying to educate him on, what, you need support, you need to condition your body, and the therapy helps. Working out is good, but what people don't appreciate is that it's actually a stressor on the body. And therapy, the physiotherapy actually helps you then to condition the body and help relieve the stress and help your body recover, so that your muscles, they can recover, they can grow, and they can function as optimally as they're expected to operate. I don't think I can speak about physiotherapy enough, whether it's with the people at the gym. Now I'm a CrossFitter. I've been doing CrossFit for almost a year. And anytime, someone would mention something, and a few times I've gone like, physiotherapy is a bit painful, let me go in for a massage. And I always feel robbed because what I pay for the massage and what I get out of it vis-a-vis what I get out of coming in for a physiotherapy session at day and night. And therefore I try to encourage people to take care of their bodies. And even as I get older, because like I said, I've never exercised. I will not say how old I am, but I am old enough to be chunguliaring perimenopause. And one of the things I have I've been learning is that muscle health, mobility are very important as women age, and how well their bodies are able to handle menopause. And so I'm also encouraged in that aspect, just knowing that I'm on the right track in terms of taking care of my old age. There's actually a meme I've seen recently that says, I'm not working for my summer body or for my beach body, I'm working for my old lady body. And that encourages me to just imagine that I can be 50, I can be 60, I'm strong, I can carry my shopping, I can go up the stairs without heaving, I can stand without holding the chair, and stuff like that. So I think in conclusion, I'll repeat what I've already said. These bodies are all you have to carry you through life. So however many years you get to live, this is the vessel that you get to exist in, and taking care of it cannot be overemphasized. And I think someone says recently that you have many problems until you have a health problem. And once you have a health problem, you only have one problem. Thank you.
My name is Nelly Ndiga. I have been your host. Do have a good night.